Hello and welcome to the Health Occupations and Long-Term Care Subcommittee meeting. It is 12:44 and we're going to have our meeting from now until 1:20. We'll adjourn at 1:20, so we will get through as much of the agenda as possible. It's gotten to the point in session where we need to be a little bit flexible, so I thank everybody for their patience with the timing of this meeting. The first bill we're going to take up is House Bill 674, which is Delegate Valentino Smith's bill. I believe, Lisa, that's your bill, right?
Yep. House Bill 674 requires the Maryland Department of Health to make site visits and conduct full surveys of a licensed nursing home if ownership of the nursing home is transferred to a person that does not own or operate another nursing home in the state at the time of the transfer. There is an amendment on page 10 of your packet, and the amendments require that the first full survey of the nursing home be conducted within 3 months after the date of transfer, and that an on-site follow-up survey be conducted within 120 days after the full survey is completed.
Okay, and we discussed this bill last week, but we did not adopt the amendments, right? Anybody remember?
Right, these are a little bit different than last week, so. Yeah.
Good. Perfect. Because they've been changed a little bit. Okay. So Delegate Valentino Smith, do you want to update us on the updates to the amendment, and then we can see if there's any questions for about the amendment?
Thank you, Madam Chair. I appreciate the tightness of the ship you're running. Also want to really commend your staff, Lisa, for her work. Where we left last week was there was a little bit of debate over what we were calling the survey. Worked with the industry. I see them on the phone, Ms. Kaufman and Mr. DeMatos, and we did as we're following the exact language of the statute. So Lisa did a good job of cleaning it up. The full survey is what's already required in law to be done within a year. So we're saying hurry up if it's a new person so we can get an eye on you. And then we're requiring the follow-up to be on site, because sometimes just a corrective plan of action can be submitted in response to a full survey. This time we're saying you have to go on site, and all surveys, the way that they're already through regulation, are unannounced. I think that was a concern Dr. Hill had, so we didn't feel the need to put the word unannounced in.
Okay, great.
So I think we've got, I think it's fair for me to represent to your subcommittee that we have at least no opposition to this.
Excellent. Do we have questions from the members of I'm sorry?
I was going to move the amendment.
Oh, okay. Sue, Delegate Krebs moved the amendment. Do we have a second?
Second.
Moved and seconded. All in favor of the amendment, say aye.
Aye.
Aye. Aye. All right. Anybody opposed? Just go ahead and raise your hand. Now we have the bill as amended. Do we have?
Move the bill as amended. It's
Second.
a great bill.
The chair is frozen. Madam Chair, you're frozen. I'm not sure if you can hear us.
I'm going to run down the hall and tell her.
Really?
We're on the same floor.
Ah, she didn't need this.
This has not happened before, where we lost our
chair.
Yeah.
I think
she'd have one insurance.
I think she's logging back in.
Right.
She's coming back.
There she is.
That was weird. Luckily, I have two laptops, so I just pivoted. So I think we're in a position where someone could move the bill as amended. Anybody?
I think I did that already. You were frozen at the time.
Perfect. Okay, so Krebs has been moved. It's been seconded. All in favor of the bill, say aye.
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 Anyone who wants to oppose it, go ahead and raise your hand in the side. I don't see any, so it passes unanimously. Thank you, Delegate Valentino Smith, and thanks to the committee for that one. Let us move on to what we'll call House Bill 983, which is the Delegate Lehman visitation bill, but we're going to be discussing the amendments to it. And I think we should all take a look at the reprint that we have, and Lisa can talk to us about this.
Okay, where
Okay,
I
so
think someone is on the YouTube link, if they could shut that down.
so are you ready for me? Okay, so
Yeah, I
House Bill
think so.
93 requires the Maryland Department of Health to develop specified guidelines relating to the restrictions of a personal care visitor and a compassionate care visitor that a nursing home may impose to reduce the spread of COVID-19. And the original bill took effect on June 1st, 2021. There's a reprint actually on page 13 of your packet. The reprint makes the bill an emergency measure. It alters the title of the bill and names it after Delegate Lewis Young's mother, and makes other technical changes. The amendments extend the scope of the bill to include catastrophic health emergencies besides COVID-19. And they specify that an individual other than a family member or legal guardian can be a compassionate care visitor. The reprint specifies that the guidelines must be consistent with federal requirements. They clarify the required content of the guidelines, and they require the guidelines to require alternative means of communication with visitors under specified circumstances. And then the last page of the reprint as legislative intent.
Excellent. So I think everybody has the reprint in front of them. Do we have questions from the committee about and I do want to let everybody know, since she's not here, Delegate Young knows about this. She's thrilled that the bill will be named in her mother's honor, is very happy with that outcome. Do we have questions from members of the committee about the amendments to the bill? I see Delegate Krebs.
I just want to clarify. So right now, if the governor puts in a state of emergency, is this basically limiting him to what he can impose on the nursing homes?
No.
I mean, I'm trying to make sure. So during this state of emergency, this is like a minimum that at least someone can come in and visit. Is that correct?
Someone from the industry might be more
Or is this
detailed answer, but basically I believe if the governor has an executive order, it would supersede the legislation.
But is this a floor versus a ceiling? In other words, is this the minimum? What if a nursing home wants to do more? Are they able? I mean, I don't want it to be, this is the floor. I don't want them
We're
to think
setting a
this is
floor. We're setting a floor that is consistent with federal law, that the point of the amendments was to make sure that we're not being more restrictive with the federal rules, but basically saying, please pay attention to this issue. It's incredibly important. We want this floor. The legislative intent language is really clear that, for this emergency and other future emergencies, this is something we care about.
All right, I just want to make sure they know that it is a floor. If they want to do more and they're allowed to do more, we hope they'll do more. This is a minimum, but it's a good bill. I just want to make sure we're not setting a standard where if somebody wants to open up even more, this has been a disaster. My mother-in-law, it started once a week now with 2 people, the same 2 people. It's like ridiculous. But anyway, go ahead.
Yeah, so I think, I don't know if Dana or Joe or Allison want to add to that, but I think we all worked together on these amendments to make sure that we were creating a floor and not doing anything that would be inadvertently restrictive. Okay, I'm seeing heads nodding. If there's no more questions, we need to adopt some amendments. Delegate Riley. Delegate Riley, do you have a question?
Sorry, can't talk without taking mute off. Sorry. Thank you, Madam Chair.
No problem.
Having some issues getting in as well just a few minutes ago. So are we on House Bill 276? Is that what we're on?
We are not on House
Okay.
Bill 983. There was a bit of language 276 put into in the reprint in 983. The part about the communications is part of that reprint. But that's
so we had 3,
which we're discussing
3 of them.
276.
Okay, so we had 3 of them. So we're amending 276 into 983 right now. So
Right, and also 806.
806. Okay.
Yeah,
But
exactly.
working off of 983. Gotcha. Thank you
Correct.
very much.
Sure, no, of course, and that's all in the reprint. And it looks like Dana is able to answer some question. Dana?
Well, before you adopt the amendment, I did reach out to Lisa earlier today, and it's just a technical amendment just for consistency language, that there's a section that talks about the other catastrophic health emergencies, diseases and other catastrophic health. And there's 2 sections in the bill, lines 18 and 24, or page 14 of your packet, where it just says diseases. And I just asked Lisa to just conform and be consistent to say diseases for other catastrophic health emergencies, just so it could be a little bit tighter. And it goes with what the intent is. So I just wanted to put that out there. Just before
We appreciate it, so we can track it. So Lisa, we're going to modify the amendment a bit to do that, right?
Yes. I'm just, yeah.
Excellent.
Yes, we're gonna add that
Taking
in.
notes, good. Okay, we will make sure that that change gets made, Dana. Thanks for noticing that. Okay, anybody want to move the amendments? I can move the amendments. Move the amendments.
Second.
Seconded. Okay, I know we still have an echo that we're working with, so I'm going to try and speak slowly, but all of those in favor of the amendment, say aye. Anyone who needs to oppose them, raise your hand.
Aye.
And I don't see any opposition, so it looks like the amendments are going to pass unanimously. I'll move the bill as amended.
Second.
Okay, any discussion on the bill? I know we've already had some, so I hope people are comfortable with doing, I think, a lot of what we can. Okay, so all in favor of the bill as amended, say aye.
Aye.
Aye. Anyone who would like to oppose it, please raise your hand and we'll make sure to note that. I'm not seeing anyone, but I'll give you a second just in case. Way to make good time, team. So it's 12:56. So that bill passes unanimously. Great work. And just caveat, we're really not supposed to name bills after people. The chairman wants me to make sure everyone knows we don't do this. We definitely don't do this. This is not a thing we do, except for this instance when we did it. Okay, so let's do the compact bills. We have a couple that have a little conversation about them. So let's start with House Bill 540, which is the OT compact. I know there's a somewhat of a technical amendment on that one. And then we'll do House Bill 736, which is the counselors, that's the administration bill. I'm hoping we have time to discuss all 4 of these, but we have 13 minutes. So it is imperative, I think, that we discuss the SIPAC issues, because I know there was
sorry, I'm on a Zoom. Can I call you back?
Conversation about them. 540. So let's do compact. I know there's a somewhat of a technical amendment on that one. And then we'll do House Bill 736. That's me talking. So somebody is playing the YouTube link at the same time as being in the room with us. It's not me. Anybody else know who it might be? That's the SIPAC issues.
Coming from
I do sound great.
Looks like Lorraine Smith.
Yeah.
Yeah, it's usually the person who actually goes on live.
Right. That's a good way to notice, Delegate Riley. Thank you. So Sharon, can you make sure to give Lorraine a text and have her make sure? Okay. Let's talk
I made that
about
mistake.
we've all been there. It's a tough, it's a whole new world for us. So let's do House Bill 540, which is the OT compact, Delegate Morgan's bill. I can't remember whose bill that is. Is that Tyler's bill?
Yes.
Okay. Can you give us an update on the compact?
Okay, yeah, House Bill 540 would enter the state of Maryland into an occupational therapy compact. There's support from let me make sure I have the right list in front of me, from the Maryland Department of Health and State Board of Occupational Therapists. It follows a lot of existing occupational therapy language. I don't know if there's any further details that members have questions about or want to get into.
Am I correct, Tyler, that you sent around some sort of technical amendment this morning on this bill?
Yes, so there's amendment from Delegate Morgan's office. It's technical in nature that would just further bring what would be added to Maryland statute in line with the compact language. Since that's an issue with compacts, they want it to match their agreed upon language as much as possible. It's all technical. it wouldn't have any impact on the application of the impact.
Okay. And one of the things I'm most interested in, committee, is that, we have 4 compact bills this year. We have 2 of them where everybody seems to be lined up in agreement. So that's the OT compact and the counselors compact, which we're going to discuss now. But, I think, the general idea of doing compacts is something the committee might be interested in, how they work, and then how we determine if we're ready to pass a compact in Maryland, if there's a need for it, if there's, if the stakeholders are all in agreement, how some boards decide to work with the folks who are looking for the compact and adapt to the financial licensing fee issues and others don't. These are the questions that are sort of the big picture overarching questions that we really need to set some policy on. But in that overall context, let's discuss specifically the OT compact. I think I see Rachel Faulkner here. Who's here to discuss this bill? You do something like wave your hands or something. I don't even know if Delegate Morgan's here, to be honest, because I'm having a hard time. I see Delegate Morgan. He's here. Okay, who else do you have here on this bill today, Delegate Morgan?
Robin Elliott is here, Madam Chair.
Perfect.
And Rachel Faulkner.
Okay, so why don't we hear from Robin and Rachel about sort of where we are with this compact and why we would want to pass it this year.
I'm going to defer to Rachel, if that's okay.
Yes.
That sounds good. So, so we're really excited. This is the first year that the compact is out. What I would say is that, this process has been over a year long. Right now, there are 14 states that have introduced legislation this session so far. That doesn't include states like Delaware, which has a longer session and so is planning to introduce legislation. So the compact only takes 10 states to enact. And so it's very likely that there could be an enacted compact by the end of the year, including Maryland, if we join along. So this would allow occupational therapists and occupational therapy assistants to not have to have a single state license in every state that they want to practice in. This is a real issue in our region, as you all know, because we are geographically a small state with lots of neighbors, and we do have lots of practitioners that work near state lines, healthcare providers that want to recruit OTs from across state lines. And right now that requires these folks to have multiple licenses in every state. So I can add a lot more, or
I'm sure you can. I know everyone's trying to be both very efficient and also make sure we answer everyone's questions. So
and we move the amendments.
The one thing that I would just add real quickly, Virginia has already passed their state compact bill for OTs. It's just waiting the governor's signature. So that's really great news. If Maryland also joined, we would immediately, when the compact's enacted, have a partner on our border.
Okay, I'll move the amendments.
That's great to hear. I think I heard Delegate Krebs move the amendments. Okay, does anyone want to second them?
Second.
Seconded by everybody. All in favor of the amendment, say aye.
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 Anybody who wants to oppose the amendment, go ahead and raise your hand, and we'll look for that, but I don't see any. So let's discuss the bill as amended. Do we have any questions for anybody on this bill? Does everybody think it's a good idea? It seems like it was all tied up in a nice bow for us.
Move the bill as amended.
Second.
Perfect. Moved and seconded by the Cullis and Krebs duo. Any further discussion? All in favor of the bill, say aye.
Aye.
Anyone is opposed? Go ahead and raise your hand. Excellent. Passes unanimously. Good job, team, and thank you. So the next one is the administration bill, House Bill 736. Who do we have here on that bill? I see Jake Whitaker is here. Jake, do you have any, who of staff is staffing that bill? Is that also Tyler? Let me go with Tyler.
No, that's me.
Am I wrong? Sorry.
That's okay. I mean, there's not a lot to explain. It's an administration bill that enters Maryland into the interstate licensed professional counselors compact. The bill takes effect July 1st, 2021, but is subject to the contingency that 9 other states enact similar legislation. The administration had recommended, and Delegate Kelly, you had said you were okay with, so I put it in your name, an amendment making the bill an emergency. So that is on page 11 of your packet.
Forgot about that.
I move the amendment. There was no opposition to the bill, and I think it was pretty well vetted, but I move the amendment.
Second.
Okay. Any discussion on the amendment? I know the intent is, obviously, this is, behavioral health is a real priority and a challenge. So all in favor of the amendment, say aye.
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 Go ahead and raise your hand. I'm not going to see any opposition to that. Okay, so the bill has been amended. Do we have any questions from the committee? While we think about that, I guess I want to ask Jake, and we could have asked this of the OT board as well. I'm confused as to how some boards can figure out how to handle the compacts without fear of, or without being crippled by the fear of losing licensing revenues, and others can't. So particularly in the behavioral health space, I'm really concerned with this issue. Do we have any idea why that is? Or why this board was okay with that? How they figured that out? Or is anyone from this board who can help us with that?
Madam Chair, it's Jake. I can't speak to the other compacts, but what I can say is there are specific provisions to allow the boards to maintain some revenue and collect some fees. So I think that'll offset some of the lost revenue from some of the out-of-state providers. So I think that plays into some of the concerns that the Board of Professional Counselors doesn't have for this compact.
Okay.
Chair, I'd be happy to add on to that. Christopher Arnold from the Department of Defense.
Oh, great.
That issue has been studied in the context of other compacts. And for example, the Pennsylvania State Nurses Association initially opposed joining the NLC back in 2015. And this past year changed their position, indicating that after 5 years of study, their initial concerns, which were twofold, one over fingerprinting and background checks, which the compact was subsequently amended, and then the other over concerns of lost revenue, never materialized. So we haven't seen that materialize in any state that's ever joined any compact, nor has any state ever left a compact subsequent to joining it.
That's really helpful context. Thank you so much. Okay, do we have further questions from the committee on this bill? I think we've been moved and seconded it already. So unless we have further questions, I'm going to go ahead and say all in favor, say aye. Aye.
Aye.
Anyone who's opposed, go ahead and raise your hand. So the bill as amended passes unanimously. Good job, team. Now, we have, based on my schedule, 4 minutes left for the last 2 compact bills. So I apologize. I'm pretty sure we're going to come back to these next week. I might be wrong, but let's start with House Bill 970, which is the SIPAC, and we will discuss it for 5 minutes so that we have enough time to deal with the podiatry bill. So do we have Delegate Johnson here this week? I can't see anything anymore.
I saw him. He was here.
Yes,
Okay, well,
Madam Chairman, I'm here.
Wonderful. So we'll have, that's a Lisa bill, if I remember correctly. Am I right? Lisa?
This is the psychology interjurisdictional compact, not the SIPAC bill.
Yeah, I think that Lisa Simpson is the staff person on that one. Is that right, Lisa?
Okay.
Yes, yeah, I am.
Yes. Okay.
This bill would enter Maryland into the psychology interjurisdictional compact for psychologists. The bill establishes procedures and requirements for psychologists to exercise the compact privilege for, and defines receiving state and distant state. It goes through all the same things as the other compacts we've just discussed. So far, there are, let's see, as of February 2021, 14 states are participating in this site. They call it the SIPAC, I guess. And like with the last bill, there is a amendment in your packet on page 12 that would make it an emergency.
Okay. So this bill, if I remember correctly, it had support from a lot of stakeholders, but we had a letter and non-present testimony, I think, from the board. So let's see, I'm trying to see who among stakeholders are here. If we have Paul Berman, I think is a psychologist, right, with Barbara Riccado, and I think we have the board here. So let's hear from Delegate Johnson first, and then we will hear from representatives from the psychologists and the board and ask questions from the committee for the next 3 minutes. Delegate Johnson, anything important to say?
Muted. Delegate Johnson, you're muted.
Thank you. Sorry about that. Madam Chair, I just wanted to go over just a couple things before I turn it over to the panel of experts. We've heard many times about the shortages of psychologists in Maryland. And this is one way that we can open up access and be able to meet the time restraints of people who are trying to get appointments. And this does not only cover mental health, but this is substance abuse. This covers such a broad spectrum of mental health. And it also addresses to some of the disparities when it comes to transportation, people who work more than one job, time restraints, college students. So it's broader than just one singular mental health situation. So for these reasons, I'm going to turn it over. And there were some questions because of the Board of Examiners had no member that could come and give testimony when we had the bill hearing. But we want to address some of the issues that they have stated in their written testimony. And I'm going to turn that over to the panel so we can address some of those issues they've had.
Great. And so whoever wants to speak on that, go ahead and speak up, but let me just have you keep it to 45 seconds because we're going to come back to this bill, I'm afraid, this week. But best case, give us your 45-second answer as to why, how we can address the opposition questions that were raised.
So if I may address the issues, Madam Chair, my name is Paul Berman, psychologist with the Maryland Psychological Association. The main issue that seems to be of concern to the Board of Examiners has to do with the credentialing and the doctoral degree requirements. I can assure and provide information to the committee that SIPAC Commission rules were passed in November 2019, I apologize, November 21, 2019, effective February 27, 2020, require a doctoral degree with the same standards from the same schools, accredited schools, American Psychological Association, Canadian Psychological Association schools, as well as schools accredited by the National Register. Issues regarding credentialing are the same, if not higher and greater in SIPAC. In addition, what I would say to the committee is this is in effect in actually 15 states, effective March 1st, and the 16th jurisdiction, DC, is effective mid-March 2021. There have been 0 complaints, and the Board of Examiners has acknowledged that the 90 people who are practicing via temporary authorization in Maryland have had 0 disciplinary action.
Okay, let's hear from, we have someone from the board, right? Lorraine is here.
Yes, good afternoon. I'm Lorraine Smith, Executive Director. I apologize that I was not able to be at the hearing. Hopefully you have received the answer, a written response to the questions you had at the hearing. And if not, I'll quickly try to review some of those. There was a question about the equivalency piece. Well, in addition to the board defining a psychology degree as graduating from a program that's approved by the American Psychological Association, there's also a designation program also that existed up until 2014. And in that designation program, psychology programs were approved to participate, and they are still recognized today, although the program does not exist. But those were considered equivalent programs back then. prior to 2014. In the actual bill on page 9, lines 16 to 20, the bill actually references the requirements for education, and it states regionally accredited. It does not state APA approved at all. It states regionally accredited. And as you know, the board operates based on statute. We do not operate based on policies or procedures that may exist outside of law. We actually follow the law. The other difficulty with this bill is that the bill, and this is on page 10, number 5, it states that if someone has a criminal background history, they cannot participate in this program. The board does not deny applications or one's ability to practice in Maryland simply based on having a criminal background check. So
let me just stop you there, because with that, you're not required to participate in the compact, right? Maryland wouldn't have to change that policy if we adopted the compact, correct?
Well, according to what we've been told and this particular bill, that what's in the bill, it's how the compact would actually function. And the bill
for the psychologists who wanted to participate in the compact.
Yes.
So if you were a psychologist who had some sort of criminal background and you were taking advantage of Maryland's different policy in that regard, you would just not be a compact participant, but you wouldn't lose your license in Maryland, right?
Exactly, which we already have that. We actually already have a temporary exception to practice compact, not a compact, but procedure. So it sounds like we would be maintaining 3 different systems here. So there would be the compact, there would be the licensure, and then there would be the temporary exception to practice. Because though that's for people who may be coming here because they have some special expertise. So they're providing some kind of testimony or they're doing evaluation. So this would be a 3rd component to practicing psychology.
Okay, I'm going to stop you right there because it's 1:16 and we have a whole nother bill to hear. Do we have questions from the committee for anybody on this panel? I'm not seeing any hands up at all. I'm going to give the committee just a second. So we're going to come back to this bill at our next meeting. It is my hope that I saw a hand up and then down. It is my hope that the stakeholders will find a way to work this out, because what I'm hearing it seems as though there's a little miscommunication about what the credentialing is. And it seems like, there's a little bit of confusion maybe at operation now, but I'm not hearing any reason why we wouldn't want to engage in the benefits of a compact for psychologists, which provide really important behavioral health services, particularly when I think states in our region are doing so. So it is my hope that we can come next week or at our next meeting, whenever that is, with more clarity on what issues actually remain versus just confusion between the parties. That's my hope. And anyone else have anything they want to add on that? All right, we will bring this up again at the next meeting, and I'm so sorry to the audiology pack folks because we don't have time for you at all, but we will bring that up at the next meeting. We will take up House Bill 182, which is Ken Kerr's podiatry bill. Delegate Hill, I believe, is in the waiting room with an amendment that she wants to discuss. So I'm going to make sure to admit her right now. And members, as you know, we have full committee in 12 minutes. So let's try and keep this to like a 4-minute conversation if we can. I'm not sure if there's anyone else from the waiting room who's taking part in this conversation. I don't know who Elmer Dengler is. We may want to let that person in. Delegate, are you inside the room? I see your picture, so that's a good sign. Hi, so this is a bill that we obviously passed out of subcommittee. We brought it back to subcommittee. Delegate Hill would like us to consider an amendment that she has been working on with Tyler. So everybody got some emails about this morning. Delegate, why don't you, while committee members take a minute to pull up their email.
Yeah, so let me just say, after the series of emails back and forth and the research that Tyler did, which showed that our statutes and our conventions are not aligned, there really is no point to offering the amendment, which was designed, frankly, to make sure that as we changed the name of a podiatrist to podiatry physician, that there wouldn't be any confusion, because traditionally physician has been not a name for doctor. It's not an equivalent of a doctor. It's a specific kind of doctor, like a doctor of pharmacy is a pharmacist and a doctor of law is a lawyer. Doctor of medicine was a physician. But in looking at the statute, it seems that even though that's the convention, that is not what we have in law. And that anyone practicing medicine, from a physical therapist to, frankly, a psychologist, podiatrist, chiropractor, can all be called physicians. So it's, there's a problem, but I don't think from Tyler's research that our statute allows us to do anything except to make no distinction at all, and to say that the word physician does not mean a person with certain training. It just means a person who practices a certain kind of care. And that was not my understanding. And so I can't press the amendment, because it's, that's it.
Okay, well, thank you for that update, and especially thank you for working with Tyler, and Tyler for all of your work digging through the code to answer these questions. Have any questions for Delegate Hill? I'm not seeing any hands up, but I'm going to give you guys a second just in case. All right, well, thank you. We really appreciate it. 121, not bad team.
Can we move the podiatry bill? Can we move House Bill 182?
I don't think we need to move it. I don't think we need to move it because we moved it 2 weeks ago.
So it's already done?
It's already done. We'll just bring it back for the full voting session.
Oh, gotcha. Perfect. Thank you.
Okay.
Okay.
Great, guys. So I'm going to end the meeting, adjourn the meeting, and we will meet again on the rest of the compact bills and a whole bunch of other stuff. Bye, everyone.
Thank you.